Look, I think learning about COVID is an ongoing exercise. The federal government has had plans in place throughout the pandemic. Whether they've always been adequate, I think the PM has said there have been some bad days. We also need to bear in mind tragic circumstances we are seeing in some homes in Victoria, but there are nearly 450 nursing homes in the Greater Melbourne and Mitchellshire area. Only a certain number of those, a significant number of those, have some COVID outbreak, but most of them are managing it well. And the front line actually is the aged care home. Where the aged care home is not meeting that need, then the government does need to be able to act. It needs to be able to act fast. And maybe it has not been able to act as fast as it should have. I think what we're seeing now is really important. We need to get in behind that and get on top of it. Unfortunately, because we have COVID rampant in a number of nursing homes, we're going to see more deaths.
There have been reports that elderly people are being turned away from hospitals. Do you think that aged care residents who do contract the virus should be automatically transferred to hospital, as is the case in some states already?
Well, there are some theoretical positions in some states that actually don't have outbreaks, but our position has been clear all along. If there is a clinical need for the person to go to hospital, it doesn't matter what age they are or where they were living before in the community or in a nursing home, they go. If there isn't a clinical need, then they get treated with the best possible clinical attention. It is not always in the best interest of the resident to be automatically sent. There are clinical decisions about them and clinical decisions about the capacity to isolate people in the home. And those decisions need to be made on clinical grounds, not on age grounds, not on whether they're a resident or not. And we were very concerned about those. But Minister Hunt has made very clear that that is the grounds on which decisions about admission should be made.
Ian, plans are expected to be put to National Cabinet this Friday for face-to-face infection control training, the mandatory use of face masks by nursing home staff and a broad audit of emergency response capabilities. Is this something that you would like to see adopted?
Absolutely. I mean, it is clear that although many aged care facilities have done really well, there are too many that have not, and there is no real alternative then I think for the government but to act and intervene faster than it had done before. And that means having teams prepared to do that. Infection control within the first 24 hours is absolutely critical. We recognise that it's hard for many homes to keep COVID out if a staff member works asymptomatic, no sign that they've got the virus, and then does infection. The key thing is what you do then. As well as taking all the screening measures in terms of your staff. But the key thing is what you do then. Some homes have clearly been caught flat-footed. They've not been geared up to do it, not to do it fast enough. Regrettably, we need the Commonwealth in there and we welcome them taking that step.
I want to talk about the Aged Care Royal Commission. One of the key findings was that the government failed to heed the lessons of earlier outbreaks. Ian, we have had various inquiries previously into aged care, but how confident are you that there will be real change?
Look, we have an aged care system that has very real weaknesses. It's 2 years that the government's had a report, 2 years that the industry has had a report that called on it to act into the workforce, that said we have very significant workforce challenges. We were on that task force. It presented a report. The bill for those recommendations would be between $3 and $3.5 billion a year. The government itself says that we need another $2 billion a year for home care packages. That by itself is a 25 to 30% increase in aged care funding. We need to see this sector upgraded in terms of government spending priorities. We need really committed funding, and we don't need to fully wait for the Royal Commission. These are things that we've, as you've said, known from many other inquiries in the past that are being raked over again by the Royal Commission. But government needs to get on the front foot early. It can then have a second go at it when the Royal Commission report is delivered early in the new year. But right now, we need to see action. We know aged care in Australia has been undervalued, underpaid for, under-resourced, and it needs to be lifted up pretty quickly.